Hello everyone. Welcome to our ongoing series of interviews with industry experts across the healthcare sector. In our interview today, we have Dr. Ravi Gaur, who has very kindly joined us. Dr. Ravi Gaur is a pioneer in the healthcare and diagnostic space. He has over 35 years of experience, and in his former role as COO of Onquist Labs and Chief Pathologist at Piramal Labs, he has been instrumental in setting up over 100 labs across India. Dr. Ravi Gaur has done some pioneering work also in the diagnostic space. Today, we welcome Dr. Ravi Gaur to our series, and we look forward to him sharing information about some of the latest trends in the allied healthcare space as well as the diagnostic space. So welcome, Dr. Ravi Gaur. It is truly a pleasure and privilege to have you today with us. Sir, as mentioned, we really would like you to share your opinions and views about the allied healthcare sector. What do you think are the current trends, and what is it that you feel is the future growth potential for this sector? So over to you, Dr. Ravi Gaur.
Yeah, welcome, and I think it's my pleasure to be here with Virohan, and I think I've been hearing a lot about the kind of training and the knowledge I think you're doing, the Virohan. It's really futuristic and really appreciate it. Thank you so much for bringing me here. Let's talk about, very important things you talked about today is allied healthcare. So first, I think we need to understand what's healthcare. Healthcare is nothing, when we talk about health, we talk about doctor. But I think you realize as a medical practitioner, as a doctor, you realize you are dependent on almost like a team of people. So it's not like a doctor. Beyond doctor, there's so many other people who are assisting doctors, handling their patients right from the moment they enter the hospital till they're discharged back home. Doctor is a central post. All those workers which is around there, those are allied healthcare workers. And this is very, very important today because that's the where specialization is happening. Every field is getting more and more specialized, and the patient is expecting a very, very personalized care in all fields. For example, in healthcare, I always believe that it's not one-man show. It's a teamwork. Better team you have, better success you would achieve, especially in healthcare. So, if you see in a hospital ward, whom do you see very often?
Nurse.
Nurse. And morning, evening doctor. Most of the time, there's a nurse or a ward boy or assistant. They are there. They look after everything. There may be a phlebotomist who comes. There may be somebody lab technologist who comes to a blood checkup, or maybe your blood sugar checkup or blood gas analysis. They are there around the clock, and those are the allied healthcare workers. And definition-wise, you can talk about, say, radiographer, take up lab technologists. You talk about and many anything we have cardiology technicians now. We have a neurology-based technician who do a ECG, EEG, and audiometry kind of a thing. People who do a stress kind of echo or Holter therapy monitoring. There is even, and when you talk about surgery, you'll also again find doctor enters the last minute. Patient is prepared from the dates, the time it enters the OT, and then discharge. So ORAs are there, then we have anesthesia assistants are there, and there's various specialties as it grows. Those are the allied healthcare workers, and I think that's the need. And once, I think we'll come back to the need later, because many a times allied people have to work in isolation. This is something which is why the allied healthcare are getting very, very important today, and without them, I think healthcare can't survive. But the credit really goes to them. Probably we'd already thank the doctor, but I think I would thank these people more. Like, I being a doctor, the leader, but I think I depend on my team, and teamwork is what makes you successful.
So, Dr. Gaur, as per a recent BCG report, there is a demand of around 65 lakhs per annum for the allied healthcare professionals. However, if we look at the figures specifically for India, the supply is of only 8 professionals per 1,000 population, which is a very alarming figure. So, what do you think is the reason for this huge gap in demand versus supply? So, while the focus is clearly on training nurses and doctors, there seems to be a huge gap in the same happening for the allied healthcare professionals. So, sir, would like to understand your views about this.
Perfectly right. I think the number is almost, they're talking about 64 lakh people will be short. Now, that's really what has happened today. Because if you recollect, go back some about 35 years back or 40 years back, everybody has a nice family physician and the doctor was everything. It's in every community, the doctor who's there, everybody goes there. He does everything. He takes your blood pressure, height, everything. And then even injection they're giving, blood sometimes they're drawing, and they take care. Probably just assisted by one assistant. But as the demand for healthcare is growing up, because there is a shortage of doctors, pressure on doctors have gone up because there is a number, if you look at this, like as of now in India even, advisable is like, one doctor per 1,000 population. But today it's about 1,400 to 1,500. And then the subspecialty, like say for psychology, it's a 1 in 7,000. So the doctors are getting too much under pressure, too much stressed out, and patient not getting the right kind of. So all they have to depend on what? They have to depend for some basic work or some initial work and a post. All these allied healthcare. That's where demand is really, really going up. That's one reason. Family physicians are no more today seen. This has become a hospital century. Everybody goes to a hospital and then because doctor skill is used there. You had appointment, doctor sees you. After that, hand it over to the allied worker. You take care.
Right.
Because they understand, they're trained. But it's not like anybody can do that. You require a proper training for it. You have to understand doctor's language. You should read the patient's mind. You should be able to read the prescription and, of course, coordinate all of it. Earlier, it was done by doctors.
Right.
GDMOs or whatever practitioner, which is not there today. That's one important part.
Right.
Second important part today, this is if you look at it, it's post-COVID specialty. The home care is...
Right, sir.
Now, in home care, I don't think we'll be able to provide doctor at home for each and every patient. Totally dependent on these care providers, health care providers or allied assist. Like for example, for diagnostic, you see today in the bigger cities, you don't find collection centers. It's all one app. You have a call, phlebotomist comes to your place, whatever time you want, whatever place you want, and blood sample is taken. Logistically, we take care of logistics because there is a technology driven, like control temperature, monitoring happening. It's all like hubs and spoke model has happened. But now, who are these? Earlier, one phlebotomist and 10 people to come to it. Now, phlebotomist is going one place. How much distance they can travel?
Right.
Patient expectation gone. So the huge demand of these phlebotomists. Same thing with labs. It's one central lab. Now, no, because everybody wants report in 4 hours, 6 hours. Turnaround time is important. So you want smaller labs, although automated. Again, the huge shortage of pathologists. Who handles these labs? These are technicians. Ultimately, good technician handles the lab, however automated it is. Ultimately, somebody has to be there. You find 200,000 labs today in our country. And pathologists, 20,000. So that means almost 180,000 labs are run by technicians in most of the places. Although maybe some pathologists are overlapping, maybe two labs or 3 labs. But ultimately, that's a big number.
Right.
So the same thing for radiology centers. Same thing is for, you can say, the eye check centers. Because basic eye screening, because machines, everything is being automated. Now, the subjectivity is not there.
Right.
So basic things, screening workers can be handled by allied workers. And preventive health checkup, BP, height, blood pressure, or you can say body analysis, all this can be done by them.
Right.
This is the reason demand is there and expectations are growing, healthcare problems are growing.
Right.
Lifestyle change. Lifespan. If you look at this, biggest number today, what they say, over 20 years, the lifespan has increased. At some time it was like 56, 58 years. Today, in the bigger cities, almost about 78, 79. And that's the average life of individual. But if you look at the average give quality life index, that was 54%. Somewhere 54 years, some 10 years back, still 56, 57. That means age is growing, we are surviving more, but our quality health-wise is probably even deteriorating. We are not. All the lifestyle changes, chronic diseases that come up more.
Right.
You want India is becoming a diabetic capital? Almost. The work culture, the sleep pattern, the stress. Younger generation is getting cardiology issues. All of the problem which was to start at 50 years, now coming at 35 to 40 years.
Right.
Again, because of lifestyle, kind of profession we are, or companies, a lot of things. So community is changed. Our expectations are too high.
Yes.
We are traveling right, left and center. Sleep patterns totally disturbed. So, that is the reason we require these preventive health checkup.
Right.
Now, preventive health checkup is just a basic necessity today. And who going to help? So,
Right.
it's these allied healthcare providers.
Absolutely.
Need is tremendous, the growth is tremendous, and especially in the tier 2, tier 3, tier 4 cities. Tier 1 is still maybe oversaturated. Delhi, you still find doctors at every corner. Moment you go out, say 200 kilometers from Delhi, you will find little. Moment you go 600 kilometers, you won't find probably one or doctor. Who are going to have these workers? And these are the allied. In fact, this was recognized by Government of India long back. If you look at in Government of India, preventive healthcare, they've got multi-purpose workers.
Right.
There's ASHA workers.
Right.
Those are the guys who villages in work. They've adopted this family, day-to-day healthcare. Now it's becoming more scientific, more technology-driven, more knowledge-driven, and integrated.
Right.
Sitting here, I can talk to my technician somewhere in the remote area, what to be done. What that person they are doing, we can monitor right here. So a new skill is definitely required. Knowledge is required. And that's the reason we need to have these growth, this huge scope. Demand is growing up, and I think there's a good opportunity for all of us probably to, but then it's responsibility also, because we train them well and make sure they are updated at most of the time. It's not like whatever was taught 30 years, because technology is changing very, very fast.
Right.
By the time you start learning technology, validate technology, something new has come up. We have to be constantly on the run.
You have to keep upskilling.
And this is the input. That's another responsibility of a teaching institutions like with us.
Yes, absolutely.
We come back every 3 years, probably an update course. Do something. Well, that's what keep you updated and futurist.
So, sir, I'd just like to share with you a little piece of information. A lot of students that join us at Virohan have actually sat for their NEET exam, and unfortunately, for whatever reasons, might not have been able to clear them. So these students actually apply to Virohan, and we educate them about the allied healthcare space. Like we were discussing, that the doctor to patient ratio is so dismal, and it becomes even worse as you move to, say, a tier 2, tier 3 town. It is extremely critical that the healthcare services which need to be supported by the allied healthcare professionals should have larger numbers of people enrolling for them. And they should be the ones supporting the doctors and nurses in ensuring that there is last mile healthcare delivery for anyone and everyone who needs the same.
Healthcare
Yes, sir.
is the 7th largest industry in the world to cover employment.
Right.
That's the kind of people we need. But
Right.
it's a huge shortage everywhere. And it's growing day by day.
It's growing day.
And it's becoming personalization. It's a human touch. You can't be like an automated kind of a thing. Even whatever automation you have, telemedicine, but there's a human being involved. And that is where I think opportunities are tremendous. I think need is too.
Okay. So you have been a pioneer in the diagnostic space, and we would really like you to share some insights. What do you mean when you say the diagnostic sector? Our students today, they are joining Virohan to build careers in allied healthcare space. We would like to inform them what are the trends in the diagnostic space and what is it that we mean by the diagnostic sector.
See, diagnostic center, again, earlier it was this, like, okay, the patient walks in and give the blood sample or get an x-ray done, ECG done and go back home. That was just a diagnostic center. Diagnostics still remain the same, but I think diagnostic is now become a center of health.
Right.
Every clinical diagnosis, every patient, there is, because it is an evidence-based medicine has been practiced nowadays. Now earlier, in fact, I remember my college time, we did, I think, MBBS way back, almost 35 years, 40 years back. And that time we were told by our professors, we were taught literally, go back and talk to the patient. Take the entire history meticulously. There are still books, how to take a history of a patient. Huge literature exists today. When you talk to the patient, you probably take a personal history, lifestyle, the family, examine physically, everything you talk. You'll get the diagnosis 80% of the time you will come to a diagnosis without any kind of
intervention.
That phase is gone today. And this was to be subjective. So there's always a chance of error. Today it's not. Today, if I have to say, examine, I can say lungs, we would just do a, percussion. Put our hands like this, tuck, 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 and he floats the lung. No, today you want an X-ray, you want a CT scan, high resolution CT scan, you want MRI. Finest thing you can pick up on the image.
Right.
Probably here you want to miss a lot of things. Same thing for, say, anemia. Doctor used to come and say, okay, let me examine. Oh, this is slightly anemic. Today, no, that's a bit break. Okay, as hemoglobin, within minutes you get an automated hemoglobin indices. You would have not even got to know anemia. This is iron deficiency, B12 deficiency, or a chronic disease. Everything is automated. So our medicine practice is becoming more refined.
Right.
Finer and precision medicines come up.
Right.
Therapies are becoming, that's one part, because this is a conventional grown like this.
Mm-hmm.
Because of automation and technology which has come up very, very fast.
Right.
Also, we have moved into an era of molecular biology. Molecular means DNA, RNA level kind of reduction. Today, we are not restricted to histopathology biopsies for a diagnosis of a lung cancer, adenocarcinoma, or squamous cell carcinoma. No. Today, we like to know what is the mutation which has happened in the tumor tissue, which genes have mutated. Because once you know these genes are mutated, you can provide clinician can go for right kind of a therapy. Those are called target-based therapies.
Right.
I am only working on the genes which is mutated. I'm not working in the entire organ. That's why you realize that today the chemotherapy has become almost painless. It's become more successful because the drug you're giving is only treating or killing the mutated gene. Earlier it was the entire organ. Burn it out.
Right.
So as we advance the therapies, everything, who is going to support?
Right.
Diagnostics.
Right.
Diagnostic center, that is why it's becoming a central. And it's got not only one part, but everything. Pathology. If you look at pathology, basic hepatology, biochemistry, immunology, microbiology, biology, molecular, cytogenetics, sequencing, everything has become now that one. Same thing, radiology. We have X-rays, we have CT, MR, mammo, every organ-specific ultrasound, small probe, large, everything is becoming diagnostic. The huge advancements. You don't find a diagnostic center earlier like a clinical school lab. It's become a nice, like a chroma store. Automated machines are lined, nice, clean, white. That's what you see there. And people are working. Because earlier it was one lab, 15 people. Now, huge lab, 2 guys are working, 4 guys are working. This is what diagnostic. Now, that's one part of diagnostic. Diagnostics also is like a pre and a post. Because what's happening inside the lab is one part. But today, also because of the need, the home care, home connections, you can say the patient being transported from one place to another, air ambulances or ambulance transported wherever accident trauma sites being kind of on the spot. Physical health checks are happening today at various places, camps are being. So this is also a pre-space. It's like on ground. When you say for phlebotomy, I explain it more. Pre-analytically, sample is picked up from home. Now who will tell the patient? The patient preparation, fasting or this thing. Those are pre-analytic, preparing the patient, collecting the sample, making a documentation, proper it is documented, there's no error, demographic error or age-specific error or whatever. Bringing the sample at the right temperature till the diagnostic center.
Right.
Because if temperature has gone up, sample get deteriorated and the right time. And somebody has to monitor that. So this is pre-analytical space. After it reaches the lab, it goes in the system. Everything is fine. That's where you quality control, everything you would have pushed to place earlier. Then post, moment this report is done, delivery. If it has not reached a doctor in time, or by the time you miss the patient.
Right.
So I think it's pre, post, and analytic. All three components are become part of a diagnostics.
Okay.
So this is the reason today, if you look at the labs, there's a department has come up called specimen reception. There's a patient reception, there's something called specimen reception. Their only job to make sure that specimen is tracked end to end, prepared well and reaches.
Right.
And after that, the report is delivered in time and it's becoming automated by. We have lab management softwares and systems, but everything has to be planned. So diagnostic centers are like, you bigger hospital exam. Earlier, you still find the Tier 3 tab, but everybody is coming up. Diagnostic center was given one corner space in a hospital. Today, it's not. They're actually showcasing them. The moment you enter, this is my diagnostics.
Right.
This is the reason, because need is too good. And I think the shape, structure is changed.
Sir, in keeping with what you just mentioned, there is a trend that we are seeing specifically, for example, in hospitals, etc. We find that the blood samples are only withdrawn, but they are sent out for testing to larger lab chains, etc. So this is a new trend that we are witnessing.
Yeah, you can't have all specialty at once, every smaller lab.
Right.
So I think the sample, there's a trend, there's a primary, if you look at diagnostic, there's a primary, secondary and tertiary, a divide to three.
Right.
Primary, then one more category has come up today. It's called near patient care or a point of care.
Right.
Primary means all your basic tests, day-to-day tests are done there. When you have a morning report, by 4 to 6 hours you get a report like hemoglobin, CBCs, or maybe you can see urine routine, or maybe blood sugar. You require 4 to 6 hours, the report that's done. Secondary is like, okay, I have to give a sample today, I can get report tomorrow. It's not an emergency, but it requires a direction for the treatment. Like the thyroids, maybe a culture, because patient has come, emergency has been tackled. Then the tertiary is a final diagnosis. I am willing to wait, like cancer diagnosis, molecular, chronic kidney disorders, autoimmune disorders, allergic disorders. This is three way of cancer: primary, secondary, and tertiary. Now, with the automation and the point of care which technologies has come, a lot of things are from primary moved into near patient at home, like what we saw in COVID. Every house has an oximeter, they had some home-based kits. Every operation theater now, or even an ICU, they find a lot of tests, blood gases there, cardiac, CPK, MB, their enzymes are done right on the spot. So, patient traveling in the ambulance, evacuate, the moment you enter, they take 5-6 blood tests, and then treatment starts, immediate treatment. So this is near patient. So whatever happened in primary, fair amount of moved into near patient. What was in secondary is moved into primary. What was in tertiary is moved into like histopathology, cytology is moved into secondary.
Okay.
Hormones, TSH or beta HCG, they have become actually very important. They have become almost like a primary. And tertiary care is like now new techniques. All the sequencing, genomics, cytogenesis, microarray, epigenetics, all this come in tertiary care. The diagnosis is now this way, the whole thing is increased because span and of course technology and the test. So if you look at this number of essays, earlier 3 to 400, now today more than 5,000 essays. That's the number of essays. And that is the reason, again, a role of diagnostic technician or a pathologist is, I have to be updated, because I don't expect my clinical friend, as a pathologist, if I don't know there are 5,000 tests, how do I expect a clinician to know about it?
Right.
You need to be totally integrated.
Right.
So this is where we have new things come about, integrated diagnostic centers.
Right.
End-to-end integration from the clinician till everything and guiding back and working together. That's the need of diagnostic today. And that's the future is like everything can be done by technology. Prescription can be seen, everything can be seen. And I think that's the shape IDC is going to take place in the future. And then the wearables and home care. A patient are wearing we've got all data coming up.
Right, sir. Absolutely.
That's also integrated now.
Right.
That's also a part of diagnostics.
Right. So, as you are aware of, in Virohan, we run programs for lab technicians and imaging technicians under the allied healthcare, space. In such programs, we have students who have certain apprehensions about the kind of job roles that they should be involved in. So, for example, some students feel that as a phlebotomist, they would not be performing the optimal, job that they were trained for, that is as a lab technician. Or, for example, an imaging technician might feel that they would want to only work in a diagnostic setup where there are MRI facilities. So, would like to understand from you, sir, what is in your opinion, the career trend that such students should aspire for?
See, I'll tell you, I think you can get a good example here. Suppose you want to be a driver or a pilot.
A driver or a pilot, okay.
So, I want to, pilot be a aircraft or a chopper or maybe a train or a tractor or a car, whatever it is. That is fine. Here you are driving a specific thing. I know this is my aircraft. I know everything. I drive it. And I'm just flying. That's it. Same thing for the tractor driver. He knows lorry, truck, everything. I know everything. This is everything I will do lifetime. This is what it is. Okay. But when it comes to medicine and healthcare, what are you driving? A human being. A human being is dynamic. Every person is needs are dynamic. So if you look at the doctor, the way they grow, you're supposed to be doing MBBS, then you do a internship, then you do a specialization, then you do a super specialization.
Right.
Nobody becomes a gastroenterologist the day one. Nobody becomes an MR specialist day one. This is where a healthcare, same for the allied, they actually have to grow. Somebody, I'm sure, I want a MRI training, MR's technician I require. Need is there. So probably healthcare for the allied people, they'd have little patience. Make a fundamental strong.
Right.
Because once you know basics, fundamental diagnostics, you just have to cherry on the top. Whatever you like. And it's not like day one, I want to be a CT scan technician. I want to be, no. Because unless you know the basics, you will miss out.
Absolutely.
Because say in pathology, unless you know, because many other people, I've seen lab technology space, who wants to do a phlebotomy? My job is only phlebotomy, no sample collection. Anything I'll not carry on doing my lifetime. Yes, nobody wants to do that. But there are people who have made opportunities huge mention out of it. They've started their collection centers, chain of home collection app, and there's a company like, wow, what else? If you look at the how was Healthian started, Tata 1mg started, Orange started, Flabo.com started. They started this. The phlebotomist collection home sample. But again, you scale up. But my point is you need to work through every phase. Unless you understand every phase, you will never be able to expertise. So my advice will be, please go have a basic.
Right.
Go back and then you identify your area of interest.
Right.
You can take a specialty course.
Right.
Basic lab technologist or basic radiographer and a capsule of MR, advice of a CT, or maybe whatever, same thing in pathology, because pathology is also like this, like okay, basic pathology, histopathology, cytogenetics, immunofluorescence, molecular. You can have a separate courses along with it, whatever you take, 10 credits for this, 2 credits for this. So you are aware of this, but straight away you want to jump to the highest specialty. I think that's not advisable, and it'll never be successful because you can. Those jobs are limited. This is.
Yeah, that was my next question. So my next question to you is with regard to which is the career that you feel is most in demand today in the diagnostic space. So for example, we have previously discussed how there is a hub and spoke model which is being followed today. I would like to understand, like for example, we keep getting demand for home sample collection. Is that one of the areas which is going to be maximum in demand? We would like to hear your views on this.
When it comes to lab, phlebotomists today is definitely huge in demand, and it will remain, come what may, because that's a fundamental thing, sample to control. Second is like, which is growing is molecular technicians, molecular pathology, because the way we have seen COVID, PCR. PCR is a very, very good technology, which has now become almost normal everywhere. So molecular is growing fast because ultimately giving a better diagnosis, more precise diagnosis. So phlebotomists, molecular technicians who are well versed with the molecular technologies, and in molecular also there's specialization. Those are, I think. Then third area is microbiology technicians, because microbiology is also now come up because now especially the infection and antimicrobial resistance coming up. A lot of tests in microbiology is growing up. That's another area because one need to look into it. Then of course lab technology will remain, general lab. This is fundamental. Only here the care is, I think, is getting automated.
Right.
So you need to supplement your skill with IT system, it was a lot of software, how to make sure their operations of the labs are taken care of. Inventory management and machine troubleshoots to be addressed, remote control. How do you talk to somebody out there? And so quality again, because getting through. So you should be well trained in the enabled processes. Do some quality courses, the documentation, because everything is getting. So the lab technician cannot be just a lab technician. Lab technician with all these operation functions.
Yeah.
This again, today everybody looks for a good lab technician. We don't find. We find lab technician, I can work a little bit because this. Because they are just picking up a sample, putting the tube into the machine and report. No, we require everything complete. Switching on the machine to closing the machine, run entire day, and keeping the sample in the archival and making sure next day is retrieved well if required. Those are the demands. It's going to be different. Then digital pathology and AI-driven models. Those another area which is coming up very, very fast. Everything in digital. X-rays already happen. Digital X-rays are there, and with telepathology, radiology is already in place. So I think how to make sure that the images, and especially in pathology, because today is now no more a microscope. You probably have to just scan these slides, the scanner, the whole slide scanners, images on the screen, the cloud, wherever you are. So your slides are prepared well. They're as per the specification. That's a skill. So digital pathologists, the biggest challenge today is getting the right kind of slides and thickness. These technicians are expert into these. They're the one. It's not a doctor.
Right.
And those additional diagnoses you can say. Then the small, you can say, point of care dice.
Yeah.
To near patient. Again, not many people are trained into a smaller devices. They're all trained into and home care is becoming a too.
Right.
So there are companies they've already developed suitcase labs. They have a big suitcase, carry it home,
Right.
go there in the center, do 15 tests. And so I think this is something with a comprehensive guy who knows what to do, preparation, I think this technology, lab technicians going to remain forever, add on to the knowledge and becoming more futuristic.
So as you are aware of, at Virohan, we follow a 50-50 coverage of academic versus practical hands-on experience in our curriculum for our students. So for example, 50% of the curriculum is covered in our campus and 50% is covered as an internship at an employer location. So for example, for a lab technician, it would be at a lab. For an OT technician, it would be at the hospital. So the question that I have for you, sir, that since you yourself also run a lab and you have in previous years also been heading these lab chains, what are the qualities that you would look at from an intern who is working at your organization, and what is it that would prompt you to actually absorb the intern on a full-time basis after their internship is completed?
I think I'll say 3-4 very important. We understand the person is an intern, so he may not be that good at skill. That's why they're coming for training here.
Right.
First foremost thing is the communication. Today, this is an era of communicate. You communicate within your group, your colleagues, communicate to the doctor, you communicate to the patients. Communication has to be good.
Yeah.
You want to speak well, talk well, and is an adaptability. It's not like, okay, I want to do only this.
Okay, flexibility.
Flexible. Because they need to be, because today is a multifunction. With automation coming up, labs don't require many of technicians, probably a lesser number, but one person will be able to handle immuno machine, biochemistry machine, hematology machines also.
Right.
So somebody has to be little flexible to work in.
Right.
Third thing is like you should be willing learner,
So,
because it's sometime like I know everything, I would read this way.
okay.
Because what you read in books is something different. It's nice, it's fun. What you actually learn ground is that's going to be life, right?
Right.
So you not be rigid on your thought. Many a time we have seen, हमने तो यही देखा था, हमने तो book में लिखा. Fine. We are following the similar principle, probably applying it differently for the better.
Right.
So I think, and this and the teamwork, of course, I'll say that. And of course, today most of the younger people are very IT savvy.
Right.
They know well about it. And then lastly is, I don't want to make them a doctor, especially the technician, but I think they should have their own analytical skill.
Okay.
Come back, like, it's not like most of the time they are the one who observation wise. They are the one, handling the sample. And every sample is minorly hemolyzed. And please look into it. So, when we talk about medicine, we call it personalized care. Here is a personalized care of the sample.
Right.
Every sample is a life for me.
Right.
That's what it is. So they should be very alert on these things, and this is going to be consequences. My report has been dished out, and small minor error in my report can create havoc outside.
Yeah.
So the alertness, sharpness, and these are the 4-5 characteristics. This is, I think, and if you know your fundamentals are right, education right, one can be easily groomed on that.
Right.
I think we all, when we interview people for interns, we all, and then lastly, it's not more technicians becoming a technicians only in the lab. The futuristic, there are a lot of people who become sales,
Right.
marketing. I've known many of my youngsters who were actually joined as a technician. Few of them are chief operating officers.
But
Many of them are, GM sales, GM marketing across. Those, I think, you need to this is the kind of opportunities you have.
right.
So that's why all this is
Or
important.
not be rigid.
Yeah, this is essential, which you learn over time. And I think, but if the basic ingredients are taught about in the institution, about little bit of exposure,
Right.
okay, keep eye on this, I think that both the things together, your technical skill.
So, sir, as we have discussed the trends in the diagnostic space, and we had said that yes, today there is the hub and spoke model. So that means there are so much more demand for, say, phlebotomists or for home sample collection, resources. However, we find in Virohan, when we ask our students to apply for such opportunities, they feel that it is a lesser of a career and might not result in great growth for them. So we would like to hear your thoughts about this.
I think I always feel that a lab technician is not complete unless he or she has done phlebotomy. Because this is very, very important part, because everything starts from phlebotomy. You should know how to draw the sample. When you draw the sample, you're not drawing the sample alone. You're talking to patient, taking history. Now you know the background of the report. So for completion's sake, I think it's very, very first step is like order of draw. Sometimes you require blood culture, even electrolytes, or maybe alcohol testing. So what could be order of draw? When you inside the lab, sample has come to me and I find that alcohol level is very high. I said, take it. I gave my report. If I'm a phlebotomist, I'm done. I will know, okay, did I take sample after clearing from alcohol swab? Maybe that is built into my sample. So this is where I'm saying the procedure of phlebotomy is not the procedure. It's like complete thing. The most important job, the first important job for a lab technician is a phlebotomist, number one. They should know in totality. Without that, they cannot survive. Because that's one part. Number two, how many bigger labs are there in the country? You just probably said, still the corporate culture labs are about 20%. If you have 200,000 labs, 20% means what? 40,000?
Right.
Beyond. The rest has been covered by these labs or technologies-driven lab.
Right.
And so how do you grow as a phlebotomist? You have to phlebotomy, technology, and later on, everybody like to have your own setup. Put up a small lab. And there, if you don't know a phlebotomy, because you can't afford, because you're getting only 40 patients a day in a. You do a phlebotomy, you do a testing, you do everything. So completion, so and this is much more paid by independent lab. As a technician, you got to grow up.
Right.
X amount of salary every year, 5% increment, 8% in archivist. After that, 20 years is technician and finished.
Right.
It may be a comfort. You're working in the AC and probably the career future growth. I think that's not. You have to know phlebotomy. You have to know everything and completion, because somewhere you got to set up your own. And trust me, the way the industry is coming up, it's a companies you can run your phlebotomists can run their own. Technicians cannot run his own multiple chain of labs. Is a phlebotomist, they can collect sample of wherever it is. They can create a lot, and then they have ample time to themselves.
Right.
They can work. And lastly, what mentioned the money word, I mean, it is of ground reality. It's a phlebotomist as compared to the technicians are paid more. So initial salary may be less, but for phlebotomy, they are charged.
Right.
Home collection, they are paid. Overall salary of a phlebotomist, because the sample is being collected, travel cost, sample collection cost, and a salary as compared to technician. Many of them, 60% of phlebotomists get more financial thing as compared to the technician. Their bill is much more. They should never look at that way, because I think future labs, and it's an automated lab. What will happen to automation? In this machine, there are labs. I've seen a lab in, say, in Delhi, like even in in Mumbai also. I've seen a lab in Madrid. They got 6,000 samples a day, 2 technicians.
Well.
But phlebotomy, this job will never go away.
So, sir, in fact, you rightly mentioned that the corporate lab chains encompass only 20% of the existing setup in India. The remaining 80% are individual labs, And when we also line up our students for interviews, etc., the demand which comes from these 80% is a student with the skill set of both phlebotomy and sample testing. So they want the students to play this dual role.
That's the first step, that's what I'm saying.
Right.
Everybody has to be just step. Checking of phlebotomy is a mandatory requirement.
Right.
And which is done by, and good phlebotomist is too much in demand.
Right.
Because ultimately, I, the pathologist, I have not seen my patient. I can still, 80% of patient I haven't seen.
Right.
My phlebotomist knows. And they call him by name. Wherever required, the call goes to him, sample le jao, okay.
Absolutely.
And so he carries that clientage with him. That's his weight.
Mentioning this, sir, recently one of the largest chains for home sample collection reached out saying that, we would like to collaborate with your students, especially the phlebotomists, to bring their clients to us.
Right.
And
that's the reason, yeah.
That is absolutely in line with what you are saying.
Yeah, ultimately, the patient is trusting somebody to put needle in there.
Right.
That's the most. If that is where phlebotomist role is very, very important role. Although it is like the field work, off-site work, no, it's never like this. Sample collection is the most important part of a lab pathologist. And unless, and this growth lies there, huge growth.
It is the fundamental. If the sample is not collected correctly, everything else.
And they can diversify.
Absolutely.
Today, when we have a preventive health check, you can always do blood BP check. They can always go for intramuscular injections. They can always do ECG at home. Why not? Today, insurance companies want to go home blood sample and ECG. They don't have 5 technicians. One going for ECG, one for this. No. Little bit of thing, and they're all automated. Scope is huge. I think very, very important to have. I think I'll probably say, given a choice, phlebotomy is more rewarding, and I think your good opportunities exist.
Right. So, as you're aware of, most of the students who join Virohan have just cleared their 12th, so they don't have any prior work experience. Once they, complete their internship, it is usually their first job that they're applying for. However, at the workplace, there are many new situations and circumstances that they have not encountered before. As a result, they don't even know how to react or maybe appropriately handle those situations. So, in this scenario, we would like you to please share what are those specific attitudes, behaviors, etc. that students should be aware of and should implement while they are on job. And more importantly, since this is a 24/7 career, actually, because there are no timings in healthcare, you don't know when you're going to fall sick. You don't know when you need to be available to provide the particular healthcare service that you've been trained for. What is it that you need to look at when you are choosing for a career in healthcare?
See, it's a healthcare industry. And healthcare, the most important part is the patient.
Right, sir.
And so what you need to be have patience. That's the most important.
Yes.
Because that's the funda.
Right.
Because it's not like you've entered in the profession by choice. And look at the example for that matter. There's a patient who comes to you. He's under a lot of pain, suffering, anxiety, worry to the attendants, the family members. You have to handle those people. You have to, what they're saying is fine, but what they're not saying also we have to understand. The silence also to be understood. You have to answer the same question 5 times because they're on the right frame of mind. You are the right frame. So fundamentally, you should have the art of listening. Listen first and try and understand why a patient or the family member or anybody is shouting at you.
Right.
Because they are not there. They never come to hospital by choice. it's by emergency or something they have been brought, and they must be under some kind of a thing. So they too much anxious. If you are saying I can't handle this language and you walk out, that's not the answer. I think that will happen. That happens everybody. Provided I think you're empathetic and you have compassion. Today's healthcare is a compassion driven care, patient-centric. Listen to the patient, understand the patient's need, because it's no more like whatever you are saying is done.
Right.
Still, they will follow what you say, but I think they are well read, they understand, and they probably have tried multiple options. Sometimes they have come to you.
Right.
They might always point out this is not right, this is not wrong. But I think so. Besides your knowledge and skill, you need to be very patient, and this happens. Especially in the younger generations, they have seen that they very frequently, probably switch on the jobs, which is not, I think, the right approach, because you have to be at one place, learn. Unless it's totally, not non-aligned with your mission or vision or your thought process.
Right.
I think it's a learning phase.
Right.
So if you stay in a place for 2 to 3 years initially, I'm sure you will be able to overcome, because you understand all parts. And your seniors, they will, what they're doing is they're probably telling you something, pointing out something, what you mentioned. Many of the people, still at our phase, we don't like it, but sometimes we realize they have something in their mind. If you don't understand what is required, what is your expectation? If your expectation you understand well, I think what my employer's expectation, what that patient, I don't think anybody will.
Absolutely.
So you probably have to go beyond books, whatever written 1, 2, 3, 4, 5. I think go all this. Understand the expectation of organization. What is your mission of work? I have to align with the vision of the organization. When it is not aligned, then situations happen.
Right. Absolutely.
So I think, but that takes time. Vision, mission, and values, all three have to be aligned. And I feel that current generation, they are very good people. They're very sharp, very intelligent, and I think they know, well read. They can guide us at many times, and we do take help. Today, I take help of when I get stuck with IT or machine. Probably tell me they come and discuss.
Right.
Because they are. We have the train the latest technology.
Right.
But I think it's a mutual give and take. Sometimes they might, your boss or senior might get angry at you. Sometimes youngster might get angry at you. But we have to take both ways. But generally, I think my advice is in the initial phases, whatever is right, whatever you feel, it goes for you. Just if somebody is scolding you, somebody is shouting you, pointing it out, learn something out of it, just throw a filter out other things. I think that will give you stability and I think good experience, and probably that builds fundamentally the future.
Probably not to take it personally, but to take it more from the perspective of your professional.
Exactly.
What is it that you can take as your growth?
Because you will not be able to understand. If I have kept a blood sample here outside,
Right.
I don't know, maybe because as a technician, this is sample, if I keep it outside for 2 hours, it get deteriorated.
Right.
Now, as a senior, I say I was a VIP patient or an important patient sample you have kept outside, this will hemolyze. I will suddenly my range, what have you done? What sample? That's the reason. It's not, there must be a reason behind it. The moment you understand the reason, I think your things go down. Listen carefully down, and I think then align. So I think never take these things a personal thing. Actually, it doesn't. A profession doesn't work.
Right.
And healthcare never work. Healthcare, everybody aim is to look after the patient, and for a pathologist, our sample is a patient for us.
Right.
We have to work on that side. And demands are too many there.
Right.
Everybody expectations are too high. I think that's a good for your future. That's an advice I think I'll say. I'll say that your hands hold the power to heal. That's the most important. And your heart will bring hope.
Right.
And your dedication will shape the future of healthcare. If you remember this, I think you will be able to be a wonderful person and a paramedics or aligned or healthcare providers. That's where the life is.
Thank you so much, Dr. Gaur, for taking time today for this wonderful conversation and for sharing so many insights which are going to be very valuable for our students. We look forward to seeing you again soon for some more conversations. Thank you again.
Thank you so much. It was a pleasure talking to you. And all the best to you guys, and you're doing great work. And I think whosoever is Virohan and the staff, I think, look beyond today. I think the future is bright, and I think you all have to, you are the future, and you have to work for that, and we look forward to it. Thank you so much.
Thank you, sir.